Our Dr. Nandi is joining us live now with more questions surrounding the Johnson & Johnson vaccine rollout process. Dr. Nandi, Johnson & Johnson saying they have 4 million doses ready to ship, yet there are few details regarding where or how it will be delivered. Why is that?
Hey, Glenda, the government has been really thin on specifics, and that's mostly because they're letting the scientific community speak first. And I agree with that, meaning they're waiting first to see if the FDA grants Johnson & Johnson's COVID-19 vaccine emergency use authorization. Then if it's a go, the federal officials will plan to roll out the vaccine without any delay. Now, the current plan is to split the 4 million doses with 2 million distributed to the states and then 2 million to health centers and pharmacies. And it doesn't seem like a lot, but another 20 million doses are expected by the end of March and then 100 million by the end of June, which will really make a big difference.
So, Dr. Nandi, when do you think the vaccine will be available?
So, Glenn, no commitment has been made about shipments that could possibly begin as early as next week. But before that can happen, there are a couple of boxes that need to be checked off. First of all, assuming the FDA gives the green light, then we'll need to hear from the ACIP. Now, what's that, right? That's the CDC's Advisory Committee on Immunization Practices. They'll make a recommendation how the vaccine should be used, right? And what age groups can get it and who should get the shot first. They have meetings scheduled February 28th and March 1st. And once they made their recommendations, then it's up to the CDC, right, to decide whether to accept them or not. And then finally, the vaccine can then get distributed and folks can start getting the shot, which would be exciting.
So if Johnson & Johnson's vaccine is granted emergency use, who do you think it will be steered toward?
And as I mentioned before, Glenna, the ACIP will certainly help with who should get the vaccine first. They'll make their recommendations. But while we wait on that plan, some states have already started considering vaccinated transient populations and homebound adults because they would really benefit from that single dose shot. And this vaccine would be much easier to distribute than Pfizer and Moderna's. Why? Because it doesn't require all the temperatures that are ultra cold and special handling. Now, I know many folks are going to say, they want to pick this vaccine versus that. I'll tell you, the best vaccine is the one that is in your arm. It's really American. It's really important that all Americans, right, get vaccinated as soon as possible. This will really help us reduce transmission. And again, as I keep saying, we can then get back to normal. And we want to stay ahead of those new variants that are coming and keep their spread at a minimum in our community. So again, whatever vaccine you can get it in your arm so we can move forward and get protected.
All right, Dr. Nandi, appreciate your insight on this Friday afternoon. Thank you for joining us. And if you have a coronavirus question for the good doctor, you can email him at drnandi@askdrnandi.com or send it to us on Facebook or Twitter. We'll get it right to him. Alan.